The hook, the moment that changes everything. Imagine sitting in a doctor's office. The room is quiet, too quiet, and then those words land on you like something physical. It's cancer. In that single moment, everything changes. The way you see the morning, the way you count your years, the way you look at the people you love. And in that moment, in that fog of fear and shock and desperate hope, most people make decisions. Fast decisions, emotional decisions, decisions that feel completely logical from the inside, but that, from a medical perspective, can make the difference between surviving and not surviving. I have spent years watching what happens after that moment, not just in the clinical data, in real human lives. And there are three things I see cancer patients do, again and again, that I need you to hear about before you or someone you love ever has to sit in that chair. These are not rare mistakes. They are extraordinarily common. And they are almost never talked about clearly enough, early enough, to prevent the harm they cause. This is that conversation. Why fear makes us vulnerable. Before we get to the three things, you need to understand something about fear. Because fear is the engine that drives every single one of these mistakes. When a person receives a cancer diagnosis, the psychological response is not rational. It cannot be. The brain shifts into survival mode immediately, and survival mode does not think in percentages and clinical trials. It thinks in hope. It grabs for anything that feels like action, anything that feels like control in a situation that has just stripped away all sense of control. And that psychological state, completely understandable, completely human, makes people extraordinarily vulnerable to three specific categories of decision-making that the evidence consistently shows cause harm. The medical system, frankly, does not do enough to protect patients from these decisions. A diagnosis appointment is overwhelming. The information given is dense and frightening. And nobody sits down with enough time to say, here are the traps. Here is what fear will tempt you to do. Here is why you must not do those things. That is what the next several minutes are for. Mistake number 1. Chasing unproven alternative cures instead of proven treatment. This is the hardest one to talk about because it requires saying something that sounds harsh to people who are desperate and frightened. There is an enormous industry built around cancer patients. It operates online, in wellness spaces, in supplement stores, in the comment sections of social media posts where someone shares their diagnosis and immediately receives hundreds of well-meaning messages pointing toward miracle protocols, alkaline diets, essential oils, high-dose supplements, herbal regimens, and treatments that claim to have been suppressed by the pharmaceutical industry. These recommendations come from people who genuinely care. That matters. But caring and helping are not the same thing. Here is what the research shows, consistently and across decades of data. Patients who delay proven treatment in favor of unproven alternative approaches have significantly worse outcomes than patients who follow evidence-based treatment from the beginning. A major study published in a leading oncology journal followed cancer patients who chose alternative medicine as their primary treatment over conventional care. Across multiple cancer types, the group that chose alternative-only treatment had death rates 2 to 5 times higher than the group that followed conventional treatment. 2 to 5 times higher. Not marginally worse, dramatically worse. And the most heartbreaking part of this data is the word delay. Because many patients eventually do return to conventional treatment, but they return after weeks or months have passed. And in cancer, time is biological. Tumors do not pause while a patient tries a protocol they found online. They continue to grow, to spread, to change in ways that make them harder to treat. A cancer caught and treated at stage 2 is a fundamentally different medical situation than the same cancer treated at stage 3 or 4. The treatment that had an 80% success rate at one stage may have a 30% success rate 6 months later. That gap, that 6 months of delay, can be the entire difference in the outcome. This is not an argument against complementary approaches used alongside conventional treatment. Many cancer centers now incorporate integrative medicine, nutrition support, acupuncture for symptom management, mindfulness for mental health, and there is good evidence for some of these approaches as supportive tools. The word is alongside, not instead of. If you or someone you love receives a cancer diagnosis, the single most important thing to do in the first weeks is to connect with an oncologist at an accredited cancer center and begin the conversation about proven treatment options. Everything else, every supplement, every dietary change, every complementary approach must be discussed openly with that team and must never replace the primary treatment plan. Your oncologist is not your enemy. The tumor is. Mistake number 2, stopping treatment because of side effects without talking to your doctor first. This one does not get nearly enough attention, and it costs lives quietly and invisibly every single year. Cancer treatment is hard. Chemotherapy, radiation, targeted therapy, immunotherapy. These treatments work by doing something aggressive to the body, and they produce side effects that range from deeply uncomfortable to genuinely debilitating. Nausea, fatigue so heavy it feels like being buried, hair loss, pain, cognitive fog, the feeling that the treatment is making you sicker than the disease. That feeling is sometimes accurate in a narrow sense. The treatment is causing suffering in the short term, but it is doing so in service of a longer-term goal, eliminating or controlling a disease that will cause far greater suffering if left untreated. Here is what happens in clinical practice far more often than most people realize. A patient is several weeks into a treatment cycle. The side effects are severe. They feel worse than they did before the diagnosis. The emotional weight of the experience is enormous, and they make a decision, privately, without calling their oncologist, to stop the medication, to skip the next infusion, to take a break and see how they feel. That decision, made in isolation without medical guidance, can have serious consequences depending on the specific treatment, the cancer type, and the treatment phase. Some treatments require a continuous schedule to maintain their effectiveness. Stopping partway through can allow cancer cells that were being suppressed to recover and develop resistance to the very treatment that was working. A drug that was controlling the disease may become significantly less effective if restarted after an unplanned break. This does not mean patients must silently endure unbearable side effects. Absolutely not. Symptom management has advanced dramatically in the past 2 decades. There are now highly effective medications for chemotherapy-induced nausea. There are protocols for managing fatigue, for protecting cognitive function, for reducing pain during treatment. Many of the side effects that patients assume are simply unavoidable can be meaningfully reduced with the right supportive care. But accessing that support requires one thing: talking to your medical team before making any decision to modify, pause, or stop treatment. If you are in treatment and the side effects feel unmanageable, that is a medical conversation, not a private decision made at home on a difficult morning. Call your oncology team. Tell them exactly what you are experiencing. Be specific and be honest. Ask what options exist for managing what you are going through. The answer is almost never stop treatment. But it might be. Adjust the dose, add anti-nausea medication, modify the schedule, add a support referral, connect you with a palliative care team who specializes in exactly this kind of symptom management. Those conversations save lives. And they happen far less often than they should because patients assume their suffering is simply part of the process and there is nothing to be done about it. There is almost always something to be done about it. But your team cannot help with what they do not know is happening. Mistake number 3, isolating yourself and refusing psychological support. This third mistake is the one that gets dismissed most often. the one that patients wave off as less important than the physical treatment, the one that the medical system itself frequently underemphasizes because it does not fit neatly into a prescription or a procedure. It is also the one with some of the strongest evidence for impact on outcomes. When a cancer diagnosis arrives, many people, particularly men, but not exclusively, respond by closing down. They tell their family, "I'm fine," when they are not. They decline therapy because they do not see themselves as someone who needs that kind of help. They manage their fear alone, in the middle of the night, when nobody else is awake and the thoughts are the loudest. This is not weakness. It is a deeply human response to a situation that feels deeply private and deeply threatening. The instinct to protect the people you love from worry. The instinct to project strength when you feel anything but strong. But here is what the research shows about that isolation. Chronic psychological stress, the kind that comes from managing a serious illness alone without adequate emotional support, produces measurable physiological effects. It elevates cortisol levels. It suppresses immune function. It affects sleep quality and appetite in ways that directly impact the body's ability to respond to treatment and recover from it. Multiple studies have found that cancer patients with strong social support networks and access to psychological care show better treatment adherence, better physical recovery, and in some cancer types, meaningfully better survival outcomes than patients who manage their diagnosis in isolation. This is not about positive thinking curing cancer. It is not a claim that attitude alone determines survival. The biology is far more complex than that. But the body's psychological state is not separate from its physical state. They operate in the same system, and supporting one genuinely supports the other. What does this mean practically? It means accepting help when it is offered. It means being honest with the people who love you about how you are actually feeling. It means taking seriously the referral to a therapist or counselor who specializes in working with cancer patients, because that is a specialized skill, and there are people who are genuinely very good at helping patients navigate exactly what you are navigating. It means considering a support group, not because sharing feelings in a circle is for everyone, but because being in a room with people who actually understand what you are going through has a documented effect on how manageable the experience feels. And it means understanding that asking for help is not a sign that you are not strong enough to handle this. It is a sign that you are smart enough to use every available tool. The summary. What to do instead. 3 mistakes. 3 patterns that fear and isolation and desperation produce in cancer patients, and 3 clear directions for what to do instead. When the diagnosis arrives, connect with a qualified oncologist at an accredited center immediately. Let evidence-based treatment be the foundation. Use complementary approaches to support that treatment, never to replace it. When the treatment becomes difficult, and it will become difficult, call your medical team before making any decision to stop or modify what you are doing. Side effects can be managed. Suffering alone cannot. And when the emotional weight of this experience becomes too heavy to carry alone, which it will, accept support. From the people who love you. From professionals who are trained for exactly this. From others who know this road. Cancer is one of the hardest things a human being can face. The medicine that exists today is more effective than at any previous point in history, but medicine works best when patients are fully engaged with it, not working around it, not disappearing from it, not suffering through it in silence. You deserve the full picture. You deserve the right support, and you deserve to make your decisions from a place of information rather than fear. That is what today was about.